Good morning, Glenn. Have your allergies been bothering you lately? Mine sure have. Spring is really bad. Actually, fall's even worse for me, but this spring I'm already starting to feel it.
You were fine on Friday, though.
I know.
Did it just happen
the
over
last
the
couple days, kicking in.
A lot of you feel stuffed up and sick all year round, though. Dr. Madan Kandula is with Advent, which stands for Advanced Ear, Nose, and Throat, and he's here to help you figure out the best way to find relief for allergy season.
Right.
Thanks for being here.
Thank you. Thanks for having me.
So a lot of people start out with medications and getting decongestants kind of over the counter.
Right.
Your thoughts on that?
Well, they're fine. I mean, really, if you think about most of the medicines that are out there treat allergies and those sorts of symptoms. And so if they work for you, that's wonderful. If they don't work, a lot of times they're not able to treat the underlying issues. So the underlying issue can be anatomy issues. This just shows a couple things out there: Afrin nasal spray and Sudafed. Both of those things are decongestants. What that means is it just shrinks down swelling on the inside of the nose. Those are okay. They don't treat the underlying problem at all. Some people can get some temporary relief with those medicines, but it doesn't give you any long-lasting relief. If you're just putting a Band-Aid on the problem, if that's what's going on.
And can you actually get addicted to decongestants? You can.
Yeah, absolutely. That Afrin spray, there's another one called Neosynephrine. Both of those sprays, you shouldn't use them for more than 3 days in a row. Lots of folks, many hundreds, thousands of folks use them once a day, twice a day. And once you start using them, it's a slippery slope. Once you start using them, you end up needing to keep on using them just to be able to breathe. And it's nice to breathe, but and when you get used to doing that, it's a good thing. But then the back end of that can be pretty miserable.
Okay. And then would your nasal blockages contribute to snoring too?
Yeah, absolutely.
Okay.
Really, when folks come in with snoring issues or potentially sleep apnea issues, the first thing, one of the first things on my mind is what's happening with their nose. If your nose is plugged up, if somebody's got snoring potential or sleep apnea potential and you plug their nose, they're going to snore like crazy. They're going to probably stop breathing like crazy. So sometimes it's as easy as fixing their nose, and then those other issues tend to subside.
For people who have a chronic stuffy nose, what are some of the best and most effective treatments for them?
Well, again, if their issues are allergies, then allergy medicines work great. There are a lot of folks who try those sorts of things, either nose sprays or allergy pills, and it's just not quite doing it. There are things in the nose called turbinates, which are little humidifiers in the nose, and those guys, not many people know of the term, but everybody knows they're turbinates. Those are the guys when you have a stuffy nose, when you have a cold, or allergies are kicking in, you can't breathe through your nose. Those are the guys that are swelling up and making you feel that way. Some folks walk around with chronically big turbinates and they're never breathing like they need to. There's things we can do nowadays where we can shrink those down permanently, and this shows that. This is the coblation turbinate reduction. What this is, we can do this in the office or sometimes with somebody asleep. We're just putting a probe into the humidifiers, and what that does is it permanently shrinks them down, similar to what a decongestant does, but it does it a lot more forcefully and it does it permanently.
Where you're not always having to take that medication.
Right, exactly.
So one of the advantages of that would be a permanent solution instead of the temporary ones.
Exactly.
And does that take care then of not only snoring if you have that problem, but also that stuffed up chronic feeling?
Yeah,
if
absolutely.
You have that all
part
the
of that, there's the stuffiness on the breathing front, and then there's sort of the congestion, full-headed feeling that goes along with it. And with the turbinates, when they swell up, they're just, your nose is literally filling up with pressure. And so when we can kind of take that pressure away, that tends to make a big difference on a lot of different fronts.
And what do you see as the advantages for the patient of that type of procedure? One of them obviously is what you said, which is that it's permanent.
And it's easy. I mean, it's something, if we do it in the office, it's something where I'll spray a little numbing medicine in there and then numb up the inside of the nose. It takes about 5 or 10 minutes to do. You're able to walk in, walk out.
Is it surgery?
Technically it's surgery, but it's it's a probe that we're putting in. It's connected to a machine that creates energy. That energy shrinks down the tissue permanently. So it's really very, very low key. I mean, it's an easy thing to have done, easy recovery. It's not a big deal.
It's 5-minute surgery.
Yeah, I know. It's
like
very,
that.
it's high-tech surgery. We hear the term deviated septum a lot.
Yeah.
What does that mean?
Well, that is, there's structure on the inside of the nose called the septum, which is a cartilaginous structure that divides your nose into two. And I think everybody's heard that term or known somebody or had something done with that. What happens is if that septum is bent one way or the other or both ways, then the nose is off track. And so this shows an example of a deviated septum, what happens after we fix that. To fix that doesn't involve surgery, and it's not a huge deal typically, but it is something that ideally people go to sleep to have done. It's a fairly straightforward fix. It's a permanent fix. A lot of times somebody's walking around with something like that and they have no idea. I mean, most of the time it's something that either happened early on in life or when, as somebody was born, and so they don't know any better. And a lot of times it's amazing, when we fix that and get them up and running, how much of a difference that makes. Not only there's the straight shot issues, which is breathing, but then a lot of issues as far as sleep and just feeling better with activity, snoring, all that sort of stuff.
And haven't those surgeries come a long way in terms of, people used to hear stories about packing the nose and then having to have those bandages removed. It's come quite a long way.
Yeah. I mean, there's packing is something I rarely have to do. So most folks who are having a deviated septum surgery don't have packing in their nose. So there's not the horror. I mean, it's still not something you want to run out and do every day, but it's a pretty relatively easy recovery. I mean, you're stuffy for about a week. You get a little bit of a bloody nose for the couple days, but you're able to be up and around and fairly quickly.
Which is nice.
We're going to make sure. Thank you so much.
Yeah.
Thank you.
Put up the information on our screen so you can get in touch, maybe have a consultation and see how you can get permanent relief. The information for Advent, Advanced Ear, Nose, and Throat Specialist, is on the screen. They're located on Mayfair Road. The phone number is 771-6780. That's in the 414 area code. And there's a web address there too for more information, advent.md. Always nice to have you.
Thank you.
And still ahead on the show, the power of Powerball.
But up next, one Milwaukee